A lot of my research right now is mostly geared towards clinical trials, which is what I call, finding treatments for the future or using treatments for the futures now. But in the long run, what I really want to do is to look at more prevention. And to that respect, I would like to actually see how to really prevent cancers in the subset of populations that are mostly afflicted by certain specific cancer. An example that comes to mind is prostate cancer in African Americans, where they are like 1.6 times likely to have prostate cancer and double the risk of death from prostate cancer. Yet, when the screening guidelines are put out, they are so not specific to this group of people, which is actually one thing that I really want to do here. So we need to find, first of all, identify to see, do studies on African Americans to know, are the guidelines that the United Services Preventative Task Force, which is actually the agency that, give prevention guidelines, are these guidelines really applicable to African Americans? So we need to find studies, to do studies on specifically this patient population, and to find out what would be the most appropriate screening strategies for them. We also need to do studies, even for prostate cancer as well. We need to do studies on people whose family have had, other cancers. We're beginning to see some in prostate cancer, some of the cancers like breast, colon cancers, having the similar genes that would predispose some patients to prostate cancers. Yet, when we talk about PSA guidelines, all of these groups are all lumped together. So the most important thing is trying to do the same thing that we're doing for cancer treatment, which is finding specific subgroup for specific treatment, to apply that to screening by finding specific screening guidelines which are applicable to specific subgroups of patient population.